Yes. Dr. Finn mentions the incidence of MRSA in UK hospitals. So you see, here it was in decade in US 2010, and here it was UK antibiotic treatment complete news, and here MRSA in UK hospitals, incidence of MRSA in UK hospitals. Okay, so mentions how infections can spread through a range of channels. Infection, not important now. This is not important now. So red mark. Sorry, red mark. Infection, red mark. Infection, an infection, red. Finish. Infection not important. Okay. So this is spread. So spread is important. So spread of infections through range of channels. Infection control is about infection. How to control? How it is spreading? How to control it? How infection develops resistance. So infection resistance to different antibiotics. How infections are spreading through range of channels. How infection is controlled. Infection control requires a wide-ranging approach. In this control of infection. This is resistance. This is spread of infection. This is control of infection. This is resistance of an infection. So what is you focusing here? You have to see these three things. Okay. Now here you can see channels. And this is approach. These are antibiotics. So spreading, control, resistance. These are the most important words. Spreading through channels, control with an approach, resistance to antibiotics. So these are the three important words. Green, the spread, how they are spreading infections, how infection can be controlled, and how resistance of an infection develops. This is how you have to check.
In this part of the test, you'll hear two different extracts. In each extract,
or uncontrolled consumption during that period. Although recent, but we simply don't know yet if it's made any impression on rates of antibiotic resistance. Other data shows that GPs have reduced the amount of antibiotics they prescribe by 13% over this period. Dentists have also reduced their prescriptions by an impressive 20%, but the figure for hospitals is much lower. So it's not an equally distributed decrease, so the picture's more complicated than it may at first appear. Something else complicating the picture is a widely reported medical research paper published recently. This suggested that short courses of antibiotics work just as well to treat most bugs as the traditional longer courses of a week or so. Those conducting trials suggested that there's insufficient data to prove that short courses encourage antibiotic resistance and argued that it's using antibiotics for longer than necessary which increases this risk. The newspapers ran away with the story, however, and sent out mixed messages by suggesting it was okay for patients to stop treatment once they started feeling better. So I'd urge caution. After all, an improvement in symptoms doesn't mean that the underlying problem has been resolved. Also, we can't recommend widespread change on the basis of one article in a medical journal. In any case, as the original authors were careful to stress, the suggestions aren't appropriate for all bacteria-based illnesses, and TB was the example they gave. Indeed, some bugs have proved especially resistant to antibiotic treatment, and the best known is probably MRSA. This came to light when, as a life-threatening condition for patients hospitalised for other reasons, it became particularly tough to treat. MRSA bacteria is notorious for being able to survive for long periods on surfaces like floors, taps, and even fabric. And of course, the fact that healthcare facilities are visited by huge numbers of people means the bacteria spread easily. But studies show that healthcare-associated MRSA declined by about 50% between 1997 and 2011, thanks to things like new guidelines and targets, as well as ward-based contact control and meticulous disinfection procedures. This shows us that rather than relying on one single action, introducing various initiatives on several fronts can limit the impact of the infection. Turning to other areas of concern,
So, question number 34. Question 34. Yes. You can submit the answer 7, 6, 5, 4, 3, 2, 1 and submit. Yes. Right. So now let's check the answer. So 34. 31, 32, 33, 34, 34. So 34 is B. Infection control requires a wide ranging approach. Yeah, 34 is B. 34 is B. So let us check how many of you have written B. A majority, all of you have written B. So update your score 0 by 1 or 1 by 1. Update your scores. We're going to do 3 tasks now. Right. Yeah. 34th question. Okay. Right. Now let us see this question. Right. Finn mentions the incidence of MRSA in UK hospitals to exemplify. To example, what to prove what? To prove what? Okay, prove what? Okay. So now incidence means occurrence. Incidence means occurrence. Okay. Incidence means occurrence. Occurrence of MRSA. So it's telling MRSA in the UK hospitals. To prove what? To prove, to exemplify, to prove what? Is giving an example to prove something. So now let us see. So to prove what? MRSA hospitals. Okay. Right. So now he is telling the influence of MRSA in UK hospitals to exemplify what? MRSA bacteria is notorious for being able to survive for long periods on surfaces like floors, okay, taps, and even fabric. And of course, the fact that healthcare facilities are visited by huge numbers of people means the bacteria spread easily. Bacteria spread easily, but okay, use the word but, very important. Studies show that healthcare associated MRSA declined by about 50% between 1997 and 2000, thanks to things like new guidelines and targets, as well as ward-based contact control and meticulous disinfectant. Try to understand. So, thanks to, why thanks to what? To things, not one thing, many things. Like number one, new guidelines and gadgets, number one, okay, ward-based contact control, and number three, meticulous disinfectant procedures. This shows that rather relying on one single action, rather instead of relying on one single action, introducing various initiatives on several fronts can limit the impact. Limit means control. Limit means control. Limit means control. Okay. Unlimited means uncontrolled. Limited means controlled. Okay. Various initiatives. Various. Wide ranging. Okay. Initiatives. Okay. Initiatives. Yeah. On several fronts. So here, now let us see. Control means limit. Okay. And then wide ranging. Wide ranging means various, multi, many, several. Okay. Approach, method, or initiative. Okay. On several fronts. Can limit the impact of the infection. Oh. Can limit the impact of the infection. See that very carefully. So, yeah, incidence means occurrence. Incidence means occurrence. Okay. Let us see here. Some bugs have proved especially resistant to antibiotic based on this. This came to light when, as a life-threatening condition prevention for other reasons, it became particular. Okay. Now let us see here. MRSA. Okay. MRSA. Hospitals. Okay. Hospitals. Right. Now, limit. Control. Various, many, wide. Okay, wide-ranging procedures, approaches, methods, techniques. Procedures, approaches, methods, techniques. So synonyms. Okay, synonyms. So what are the three? There are 1, 2, 3. Okay, new guidelines and targets, word-based contact control, meticulous designation, procedures, all these things. Okay, initiatives, steps, measures, approaches. Initiatives, steps, measures, approaches. Okay, all these things. So, right. This is the way how you can identify this particular question. Yeah. So this is like reading now. Yes. Next. Next. What does Dr. Finn find most shocking, appalling, surprising about antibiotics used on livestock? Antibiotics on livestock. Antibiotics on livestock. They are routinely consumed by healthy animals. These livestock are routinely consumed on healthy animals. There is a probable link with the drug resistance in humans. The total amount given to animals exceeds than used by humans. Now let us see. So, what does Dr. Finn find most shocking about antibiotics being used on livestock? So, antibiotics, they are routinely consumed by healthy animals. There is a probable link with the drug resistance in humans. The total amount given to animals exceeds that of humans. So this is focusing only on animals. This is focused on only on humans. And this is focusing on comparison with animals and humans. First one only animals. Second one only humans. Okay, right? And third one animals and humans. See this one difference. They are routinely consumed. So it is talking about consumption. There is probable link with drug resistance. This is about resistance. The total amount given to animals, this is a quantity. So consumption, resistance, and amount. Okay. Animals, humans, animals, and humans. So this is the way how you are going to identify. Okay. Yeah. Yes, this is the 35th question. Yeah.
Change on the basis of one article in a medical journal. In any case, as the original authors were careful to stress, the suggestions aren't appropriate for all bacteria-based illnesses, and TB was the example they gave. Indeed, some bugs have proved especially resistant to antibiotic treatment, and the best known is probably MRSA. This came to light when, as a life-threatening condition for patients hospitalised for other reasons, it became particularly tough to treat. MRSA bacteria is notorious for being able to survive for long periods on surfaces like floors, taps, and even fabric. And of course, the fact that healthcare facilities are visited by huge numbers of people means the bacteria spread easily. But studies show that healthcare-associated MRSA declined by about 50% between 1997 and 2011, thanks to things like new guidelines and targets, as well as ward-based contact control and meticulous disinfection procedures. This shows us that rather than relying on one single action, introducing various initiatives on several fronts can limit the impact of the infection. Turning to other areas of concern, let's look at antibiotics in agriculture and livestock rearing. People might be surprised to learn that worldwide, the overall quantity of antibiotics used in food production is now higher than the amount consumed by humans. Something which horrifies me is that antibiotics are consumed by animals as a matter of course, simply to prevent problems, or indeed to speed up their growth. This happens a lot in intensive farming, where animals are kept in confined conditions. We've known for years now that this overuse is directly related to resistance in humans, so there's obviously an urgent need for farmers to cut down. So, is there any progress to report? Well, though there's still serious work to be done in places, for example for manufacturers of antibiotics to stop discharging untreated waste products into watercourses,
Question number 35. Submit your answer. 7, 6, 5, 4, 3, 2, 1. Submit. Yeah. So, majority vote is A. Now let us check the answer. (35). Answer number 35 is A. Okay. Yes. Now look at this. So, if you see this clearly, shocking, antibiotics, livestock. Okay. Turning to other areas of concern, let's look at antibiotics. Yeah, update your scores, please. Antibiotics used in livestock, used on livestock rearing, agricultural and livestock rearing. Okay, now let us see. So, antibiotics. Livestock. Okay. People might be surprised and shocking. Okay. Surprised. The next one, used. Used. Okay. That is surprised. But is this surprised shocking? Okay. Surprised is not shocking. Surprised is not shocking. So horrifies is the word shocking. Dr. Finn. It's not about people, it is about Dr. Finn, me. Okay. Right? Now just check it out here. Shocking means horrifies. Me means Dr. Finn. Is that antibiotics? See, here is the point actually. That is not the point which we have to consider. The main point is here. Is that antibiotics now if we go further here, horrifies me, Dr. Finn, is that antibiotics okay consumed by animals okay. So now here it's very clear. So Dr. Finn horrifies, shocking, antibiotics, okay, animals, livestock, okay, livestock, that is animals consumed, okay. So they are routinely consumed by healthy animals. It's talking about animals. Livestock means animals. Livestock means animals. Okay. Right? So, as a matter of course, simply to prevent problems or indeed to speed up their growth. Okay. So So try to understand this point here, right? Okay. Yeah. So 35 is A. Is A, right? 35 is A. Okay. So try to understand here very clear. Consumed, animals, okay, livestock, animals, antibiotics, shocking, horrifies. Dr. Finn, me. So this is the way how everything is related here. So this is the way how you have to analyze the question. Yes. Next. 6th question, 36th question. Dr. Finn welcomes the progress that has been made in the dash. Progress. Okay. Dr. Finn welcomes. And this progress made in which progress in what? Production of new antibiotics. Production of new antibiotics by. So production. Control of levels of antibiotic waste in the environment. So control of antibiotic wastes. Yeah. Control of antibiotic wastes. This production of new antibiotics. Control of waste. Okay, antibiotics is common. Selective use of antibiotics to target specific infections. Selective use to target infections. Selective use for infections. Selection based on the infections. So these are the things we can focus. Yeah. So 36th question.
Floors, taps, and even fabric. And of course, the fact that healthcare facilities are visited by huge numbers of people means the bacteria spread easily. But studies show that healthcare-associated MRSA declined by about 50% between 1997 and 2011, thanks to things like new guidelines and targets, as well as ward-based contact control and meticulous disinfection procedures. This shows us that rather than relying on one single action, introducing various initiatives on several fronts can limit the impact of the infection. Turning to other areas of concern, let's look at antibiotics in agriculture and livestock rearing. People might be surprised to learn that worldwide, the overall quantity of antibiotics used in food production is now higher than the amount consumed by humans. Something which horrifies me is that antibiotics are consumed by animals as a matter of course, simply to prevent problems or indeed to speed up their growth. This happens a lot in intensive farming, where animals are kept in confined conditions. We've known for years now that this overuse is directly related to resistance in humans, so there's obviously an urgent need for farmers to cut down. So, is there any progress to report? Well, though there's still serious work to be done in places, for example for manufacturers of antibiotics to stop discharging untreated waste products into watercourses and so on, it's not all doom and gloom. We're finding now that when doctors prescribe antibiotics, they're choosing narrow-spectrum ones. These are active only against specific bacteria and so cause less general resistance. And something which is being talked about excitedly in the pharmaceutical industry just now is a therapy which uses bacterial viruses called phages to treat infections, something which was first practiced about a century ago. Antibacterial therapies, whether phage or antibiotic-based, have advantages and disadvantages, and there's still a lot to be learned about the interactions between phage, bacteria, and human host. But maybe the time to take phage therapy seriously is rapidly approaching. Now, before I go on to the next thing,
Now look at Extract 2. Extract 2. Questions 30.
Yeah. Question 36. Question 36. Yeah. 7, 6, 5, 4, 3, 2, 1, and submit. So all the three answers are coming up. C, A, and B. Yeah. So mixed answers. Okay, fine. Let us check our answer. Answer is C. Answer is C. Yeah. So, last question. Right. Yes. See here now. So update your scores, please. Update your scores. So how many you got out of 3? So progress has been made in the, Dr. Finn welcomes the progress that has been made in the, yeah. So here, yeah. So Dr. Finn welcomes. Welcomes means appreciates. Welcomes means appreciates. Dr. Finn welcomes. Progress made in. Yeah. Now, Dr. Finn welcomes progress that has. Yeah. Yeah, 36th answer. Here it is. This is 36th answer. Okay. Now let us see. Welcomes progress that has made in the production of new antibiotics. Okay. Production of new antibiotics. Production of new antibiotics. And select control waste. Then selective use. Selective use. Now let us see this very clearly. So welcomes. Welcomes means appreciates. Now progress. Now let us see. And something which is being talked about exactly in the pharmaceutical just now is the therapy which uses bacterial viruses called phages to treat phage, to treat infections. Something which was first practiced about a century ago. Antibiotic therapies, whether phage or antibiotic based, have learned, and there's still a lot to be learned about the interaction between phage bacteria and human host. But maybe the time to take phage therapy seriously still. Okay. Now let us see here. We are finding now that when doctors prescribe antibiotics, they are choosing narrow spectrum ones. Narrow spectrum ones. Narrow spectrum. Spectrum means focus. Okay. Spectrum. Narrow spectrum. Narrow. The focus is limited. So narrow spectrum. Narrow spectrum means what? Limited zone. Limited zone. Narrow spectrum, limited zone. So target is limited now. Okay. Right? Narrow spectrum ones. These are active only against specific bacteria. These are active only about specific bacteria. Okay. And so cause less general resistance. So try to understand here very carefully. Okay. So 36th option is C. But what I'm asking you here is Yeah. Yeah. So, progress. Is there any progress? Here it is. Is there any progress? He's asking. Is there any progress report? Well, though there's still serious work to be done in places. Okay. It's not all doom and gloom. That means something better is there. We are finding out now that when doctors prescribe, they are choosing narrow spectrum ones. These are active only limited. Only means limited. Okay, limit, control, that is target. Target is limited already now. Limited to specific. Specific. Okay. Limited to specific infection. So against bacteria and so cause less general resistance. So the use of antibiotics. The use of antibiotics. They are choosing narrow spectrum antibiotics. Narrow spectrum antibiotics. Okay. So yes. Choosing means selective. Spectrum means target. Specific only. Okay. Right. So you can see specific means only specific. So use of antibiotics. They are choosing narrow spectrum ones. Ones means antibiotics. Okay. So that is development, right? That's the advantage. Doom and gloom is negative. Now this is something positive. Okay. So this is how you have to identify. Only these are active only against specific bacteria and so cause less general resistance. Narrow spectrum ones. Okay. So 36, that is what it says. See, you can very clearly see there, right? So based on that one, you have to find out what is telling. They are choosing. Choosing means selection. Choosing means selection. Narrow spectrum. Once means antibiotics. Narrow spectrum antibiotics. Okay. So this is the way how you can analyze the question. Right. So you have given your scores and practice the session. So take these points and learn these styles. select the words, use these words which you are using here in every area.